New parents are bombarded with conflicting information about feeding their babies. However, by following the right guidelines, you can ensure that your baby has the healthiest start possible. Hi, I'm Dr. Lakshmi, and you're watching Yashoda Hospital's The Health Talk session, where all your health-related queries are answered here. So let's discuss about the importance of nutrition for the newborn baby. Joining our discussion today is Dr. Tejaswi Reddy, Consultant Neonatologist and Paediatrician from Yashoda Hospital, Malakpet. Welcome to the program, Doctor.
Hi.
So, Doctor, new parents have a lot on their mind, including serving the best food for the babies. So, to begin with, what is the nutritional requirement for the newborn baby and what is its significance?
So the nutritional requirements differ from term to preterm baby. So a term baby is a baby who is born after 37 weeks of gestational age, and a preterm baby is a baby who is born before 37 weeks of gestational age. So how do we know whether the baby is requiring adequate nutritional supplementation or not? So this is mostly by the weight gain that we assess. So normally in the first few days of life, a neonate will show a fall in the weight. So there will be a weight loss in the first few days. So after 14 days of life, that is in the 1 to 2 weeks, a term baby will regain its birth weight, whereas a preterm baby will regain its birth weight at 2 to 3 weeks of life. So after that, till the baby reaches 2 kgs, there has to be a weight gain of around 15 to 20 grams per kg per day. And after the baby reaches more than 2 kgs, there has to be a weight gain of 15 to 20 grams per day. So if the baby is not able to have this weight gain, so we call it as extrauterine growth restriction. So this may have short-term implications as well as long-term implications. So short-term implications, the baby can land up into dehydration, shock, jaundice, then acute kidney injuries, then seizures. And long-term implications, baby can have adverse neurodevelopmental outcomes. So baby can have cognitive decline and developmental delays also.
So you were mentioning about a preterm and a term baby. So is there any difference in feeding these two babies, and how do we establish a feed in a preterm neonate, Doctor?
So definitely there is a significant difference in providing nutrition to a term and a preterm neonate. Term baby is mature enough. The baby has proper suck, swallow and coordination cycle. Baby can easily latch onto mother's breast and can take in the milk. But for a preterm baby, it's a very big challenge. So if we take for an example, a 28-weeker baby who is less than 1 kg, so in that baby, we generally start with total parenteral nutrition. That is the carbohydrates, proteins, fats and all the requirements which a baby needs are being fed intravenously. That is through the parenteral route. So apart from that, baby is also being given enteral nutrition also, which we start at a very minimal rate, which is called as minimal enteral nutrition or trophic feeding. We start at 15 to 20 ml per kg per day, and based upon the baby's tolerance, we try to advance. So once the baby is able to reach an oral feed of 120 ml per kg per day, we generally tend to stop parenteral nutrition and put the baby on oral feeds only. So once the baby reaches oral feeds, first initially we start the baby on OG tubes, that is the mode of feeding. So once the baby develops this suck-swallow coordination, which is at around 32 weeks of age, that is the time when we start the baby on spoon feeds. So once the baby is able to take spoon feeds, then at around 34 weeks of age, baby is put to direct breastfeeding. So this is how we transition the feed from OG tube to direct breastfeeding. So in order to help this transition occur at a faster rate, we introduce non-nutritive sucking and kangaroo mother care. Non-nutritive sucking is when the baby latches onto empty breast of the mother, and kangaroo mother care when the baby is kept on the mother's body in between the two breasts. So this will help in faster gain of weight on exclusive breastfeeding rates and faster discharge from the hospital.
So discussing about the importance of feeding a neonate baby, Doctor, what are the different feeding options which are available today?
First is the mother's own milk. We call it as mother's own milk because it is customized to her own baby. So why is it so important to have mother's own milk? Because of the advantages that it offers, not only to the baby but also to the mother. So in a baby, it has both short-term as well as long-term advantages. Short-term, it prevents from infection. It has anti-infective properties, that is antibodies and immunoglobulins, and it has enzymes, digestive enzymes like lactoferrin, lysozyme, It also has other probiotics, which are nothing but beneficial bacteria that help in maturation of the gut. So thus it helps in decreasing necrotizing enterocolitis. Apart from that, the protein that is available in breast milk is whey protein, which is much more in quantity than casein protein. So this is easily digested by the baby. So that is the reason the chances of feed intolerance in a baby who is breastfed is very less. Now coming to long-term advantages of breast milk, baby who is breastfed has a higher IQ than a baby who is not breastfed, and baby will have decreased incidence of allergies and atopies, and decreased incidence of lifestyle disorders like obesity, diabetes, then cardiovascular diseases. Coming to the advantages which a mother has, a mother will be able to establish a proper attachment and bonding with the baby. There will be decreased postprandial bleeding. Apart from that, mother will also have decreased breast carcinomas and also ovarian carcinomas. And even weight loss will also be augmented. So now the next option after breast milk is the donor milk. So this donor milk is provided to babies who are not getting adequate milk supply from their own mothers. So this breast milk is screened from infections, is treated at a higher temperature, which is called pasteurization. So thus that would eliminate infections. And then this milk is provided to the recipient, which is a preterm baby. So apart from these two options, we have a third option, which is called formula feeding. So this is being provided to term neonates, especially who are more than 34 weeks, as well as more than 1.5 kgs, for whom the breast milk is not available, like mother's own milk is not available, and even donor's milk is not available.
So you've made a point that feeding a preterm baby is undoubtedly a challenge. So what are other situations which prevents a neonatologist from feeding a neonate doctor?
So earlier, whenever there was an extreme preterm neonate, we used to temporarily withhold the feed. But nowadays, we are continuing the feeds. We are starting minimal enteral nutrition. And if the baby is developing any signs of feed intolerance, like abdomen is tense, abdomen is shiny, there are gastric residues seen in the orogastric tube. And in those conditions, we tend to initially skip the feeds, 1 or 2 feeds. And if still that is not helping, then we go towards withholding the feeds temporarily. And around 1/4 of the babies who are feed intolerant, they are actually diagnosed with necrotizing enterocolitis. After these two conditions, there is also, if the baby is severely sick and if the baby is in shock, there is mesenteric perfusion, that is perfusion to the gut is hampered. So in those cases also, we tend to stop the feeds. Apart from that, there is babies who are intrauterine growth restricted, so they are diagnosed antenatally. In their scan reports, we tend to see that there are some Doppler abnormalities, like there could be absent of flow or reversal of flow, which is easily evident on these antenatal scans. And in those cases, it becomes a great challenge to establish feeds in them because they also tend to become feed intolerant. Now, lastly, we have surgical conditions like congenital diaphragmatic hernia, tracheoesophageal fistulas, malrotations. In these conditions, feeds can be established only once the surgery is completed and the surgical cause is reversed.
So I'm sure we all know the importance of mother's milk for a baby. So apart from this, is there any additional requirement or supplements that a baby would be needing?
For a term baby who is taking exclusive breast milk from a mother, you need to supplement them with vitamin D because mother's breast milk is deficient in vitamin D. Coming to late preterm, that is 34 to 37 weeker baby, apart from vitamin D, we need to even supplement with iron. So this is done at around 2 to 4 weeks of age. And coming to babies who are less than 34 weeks of age, we need to supplement apart from iron, vitamin D, calcium, phosphorus and multivitamin. So even though the preterm baby is completely fed with preterm human milk, sometimes we do see that they are not catching up weight at a required pace. So this is because the preterm human milk is lacking in proteins and other nutrients. So for this reason, we introduce human milk fortifier, which is also called as HMF sachets, to babies who are preterm. That is babies who are less than 32 to 34 weeker, who are less than 1.5 kgs. So this is being done in NICU to preterm babies who have reached a volume of 80 to 100 ml per kg per day. So these are the supplements that would be required for a neonate to prevent any deficiencies that would arise out of giving exclusive breastfeeding.
So doctor, once a baby is delivered, how do you ensure that adequate nutrition is met once the baby is delivered from the hospital?
So once the baby is discharged from the hospital, it becomes more challenging to ensure proper nutrition in them. So whenever we are discharging the baby, so the baby has to be free from any medical ailments, baby is not on any medications. then we tend to discharge only those babies who are showing a stable phase of growth. That is, they are growing at a stable phase for a consecutive period of 3 days. Apart from that, it is very important that the mothers are confident in looking after the baby after they discharge. If we are convinced that the mother is confident, mother can look after the baby, the feeding, the mother can identify the danger signs, we tend to discharge the baby. And once the baby is discharged, we ensure that the mother sustains lactation and thermoregulation, that is the temperature of the baby is adequately maintained, because the baby has to be kept warm. If at all the baby turns cold, the energy that the baby is getting from the nutrition is being utilized in making the baby warm. So in that way, babies do not show us a weight gain. Apart from that, we tell them to continue fortification till 2 to 2.5 kgs, and the supplements have to be continued. Then once the baby reaches out during the frequent follow-ups that we order, so we tend to monitor the growth, the development, and if at all there is any abnormal deviations from the normal, we tend to address them.
So before we wrap this episode, Doctor, what message you would like to convey to our audience out there, especially for new mothers and family?
So my message to new mothers is they have to be more educated. So they should know what is lactation, what is the importance of lactation, how is breastfeeding beneficial for themselves, for their babies, right from the antenatal period. So try to attend lactational counselings and lactational classes which are being conducted during the antenatal period itself. So once in the postnatal period, when the baby is born, try to be in close proximity to your baby, because that not only helps developing an attachment between the both, but also it helps in increasing the milk production. And if at all there is any lactational assistance required, so you should be free to consult any professional. Do not hesitate in taking help. And last but not the least, it is very important that you consider yourself also to be equally important, because your health is equally important. You should take utmost care in maintaining nutrition and health, your health, especially the physical health, mental health, your sleep, everything has to be taken care of. And finally, do not impose any nutritional restrictions unless and until it is advised by your doctor.
So thank you, Dr. Tejaswi. It was wonderful having you here on our program today.
Thank you.
So this brings us to the end of this episode. Hope this episode was enlightening and empowering, and don't forget to join us for next week as well. Until then, take care and stay healthy. Thank you.